sharing any project or any innovation. I will just be sharing some thoughts that I've accumulated this past 2 years working, especially on social accountability in IFMSA. So in 1969, the Association of American Medical Colleges actually came forward with some recommendations for medical schools. And some of those recommendations were that medical schools should ensure wider participation and representation in education, that they should ensure interprofessional education, and that they should feed into the health service. And I think we can argue that those recommendations have given birth to social accountability as we know it today, almost 50 years later. Only the difference is that now this conversation is not just happening formally, at least in the United States and Canada. It has moved all over the world in countries of all incomes. So this has been now a global conversation. However, I wanted to also ask everyone a question. Is it really the same discussion that we're having these days? We've seen a lot of research come forward, a lot of recommendations on how we can empower communities and how we can make medical education more socially accountable. But are these recommendations relevant and applicable to everyone that's part of this discussion? And that is what I'm trying to find out as well. From creating a new curriculum to creating teaching units in rural and remote areas, or creating staff positions for faculty members to work on social accountability full-time, have we stopped to think what are the financial implications of such recommendations? I think very often we overlook the human and financial resources that are needed, and we forget that there are places in the world that are not many times the ones that we would think they are, that do not even have the resources to begin with. And this is a harsh reality that I had to come to terms with when I began studying in a country that was stricken by austerity measures and a very, very, very big recession, where medical schools were not even able to sustain their existence. So this is my final point that I want to share, that I want to remind everyone here that while there are many of us today, many professionals from different disciplines actually, there are many more that are not represented here today, and that those that need social accountability and community empowerment the most are not in this room, and they're not probably in this conference either. And I wanted to remind us all that these are the people that we should be working for. And I would say that my final remark would be that moving forward, and we still have a long way to go, our biggest challenge is going to be to transmit our message to frequencies that everyone can actually hear, and not just a few that have been part of this journey with us in the network talks so far.